to Real People, Real Matters with Diana Tulchinsky. My first guest is Dr. Irina Tutunikov of the Glenview practice. Dr. Irina, please tell me about your earlier life in Ukraine.
I was born in Kharkov, Ukraine, eastern Ukraine. Nowadays, the city is called Kharkiv. And I lived there up until I was 26. I went through my schooling there, my elementary, high school, and higher education as well, but not in medicine.
What was it like with your grandparents and parents? Were they practicing humanities, or they practicing for you to go into the sciences?
Everybody had very different background. My grandfather was an engineer, my grandmother was a teacher of German, my mom was a historian, and my father was a physicist, so it was a good mixture, but nobody was in medicine.
What was your love in the humanities when you started university, like languages and arts?
I always liked that, and I guess there is no person in the world who wouldn't like literature and languages, and I was excelling in it, and ended up picking up languages and literature as my profession.
Were you teaching at the university level?
Yes, I was.
And why did you pursue going to the United States?
Well, it's a pursuit of happiness, right?
Yes.
That's what brings everybody here, and I guess it was my case as well.
Tell me, did your husband help you, encourage you to go to Philadelphia Medical School?
Well, yes, at the time we lived in Philadelphia, and he was very encouraging and very helpful. It was a turning sort of point in my career. I took a GMAT and was accepted to an MBA program, but we sat down and we talked about it, and my husband just said, why wouldn't you pursue what you really love? And I always loved medicine. I was always reading articles, popular scientific articles, to the best of my ability. And he said, instead of just wasting your time and energy on something you don't really like, why wouldn't you go into the field that you really like? And I gave it a good thought and decided to take pre-med classes. I was shadowing in the ER of one of the hospitals in Philadelphia, and I decided that that was really my calling, and I pursued it.
Very nice that Americans pursue their calling. Right. Where did you complete your residency?
I completed my residency here in Chicago area. I started in Philadelphia at the Temple University Physical Medicine and Rehab program, but ended up in internal medicine here in Evanston, Illinois.
What were some of the cases in St. Francis and other hospitals, like long-term care, that you saw?
Well, we saw a lot of patients sort of being brought in every couple of weeks with the same problems, unfortunately, pneumonia, UTI, pretty hopeless cases, and it was not always very cheerful experience on inpatient wards in the hospital. We saw everything, all kinds of diseases. And while working there, I started thinking that there should be a slightly different approach, not a slightly different approach, but probably dramatically different approach to health, restoring health. And that's when I started my journey on looking for alternative treatments, or more so complementary treatments, because many of the cases that I saw on hospital wards were not very inspirational.
What's the difference between functional medicine and conventional medicine?
So basically, functional medicine is the medicine the way it's supposed to be. It's looking at a patient as a whole rather than a collection of different organs, and treating the whole person, body, mind, spirit, versus treating rheumatoid arthritis or kidney disease. It's looking at the patient at a totally different lens. So, and instead of finding symptoms and connecting them to certain diagnosis and thinking, oh, here is a medication to control this, we are thinking about it, what causes that? How can we help to eradicate the cause of the disease rather than just putting a Band-Aid on a certain symptom? So that's the main difference.
So it's more preventive medicine than maintenance in conventional.
Right, but also it's a different approach to a very sick people as well. Chronically ill people who were put on certain medication for life and were not given any hope to get better. So they were just labeled with a diagnosis, and we are trying to look for deeper layers of it.
Do you have any successful patients or successful long-term patient that you've seen, or any encouragement of why you left into functional medicine?
In the functional medicine world, I see a lot of very inspiring stories. A lot of people are getting better. I cannot really attest that much for the patient that I saw in residency, because you are rotating through different floors, through different specialties, and not necessarily seeing exactly the same people for a long period of time. So while you are on a rotation for a month or 2 months, you might see the same person coming in and out, but you do not necessarily know what is happening to this person down the line in a certain period of time. So I can just say more about the outpatient clinic where we saw patients, and pretty much we were increasing their doses of antihypertensives and anti-diabetic drugs, and it was pretty discouraging. So, and made me look for a different approach, as I already mentioned.
What is the positive about women's health that you are encouraging women and their families? Like, how are you doing in treating biohormonal therapy for women in the 30s and 40s that have problems with children or even menopausal?
Well, women probably constitute the majority of my patients. Not because I discriminate against men, but women are coming more often than men do. So I see different ages, from late teens up until 70s and even 80s. And the menopausal symptoms are actually the most frequent presentation that people come to see me for. It's either when they are premenopausal or perimenopausal and just going through the beginning of the changes, or some people I see who were seen by other physicians prior to be seen by me, and they come in on certain medications, on hormones, which I have to adjust. So the hormone replacement therapy is extremely important. Hormonal balance is extremely important for women's health. When that goes out of balance, a lot of systems start to break down. So it's important to find that right moment when you start the therapy. And not only hormones per se are very important, but also lifestyle changes and maybe even slowing down with their job, and maybe adjusting exercises to a new age. And of course, looking into the diet and stress management is very important. But bioidentical hormones definitely a very big part of my practice.
And how do you treat women that have diabetes 1, diabetes 2? What's the long-term therapy for that?
So diabetes 1 is an autoimmune disease. And if people are already on insulin, that means that their pancreas is already compromised and not producing its own insulin. So here it's important to maintain their general health and inflammation level, to keep up their general health and to make sure that inflammation is kept down. You we do not have at this moment an ability to restore the pancreatic function. So for type 1, the insulin, unfortunately, they remain on insulin.
Yes.
But diet, of course, and lifestyle and general approach of anti-aging functional medicine, such as making sure that there is no toxicities involved, other hormonal disbalances, or micronutrient deficiencies here at play. So this is my role to make sure that all of this is corrected. And as far as type 2 is very much a reversible disease, because if the pancreatic function is still preserved, even if a person is on insulin, it is possible to reverse it.
And I was just wondering, is it lifestyle, or is it like how long do you work with a successful patient? How many months or even years do you cut down on the sugar and the wheat and the white products for diabetes 2?
Well, that would be a common approach, not only for diabetes 2, but for anybody who comes in. And it depends on the severity of the disease, on the willingness of the patient to drastically change lifestyle, because sometimes it does require a drastic change. But it's difficult to change everything overnight. So for some people, the change happens more smoothly, but for others, it takes months to just make sure that a patient following a good diet, appropriate diet for him or her. So my goal is just to see a patient once a year for a checkup. But that might take a couple of years at least, because not every change can be implemented at the same time. The body will not take all the changes at once. So it's a stepwise process. I start with the most important things and then progress to others. So preferably, I will not see a patient at all, so he or she will be so healthy that they will not need anybody. But it takes time to get to that point. And my patients, they are active participants. They are equal partners in our process of healing. And as much, or even much more, depends on them than on me, because I am here to give them advice, but it's their job to actually follow this advice and do their work.
For the aging population, do you do anything for arthritis or inflammatory joints, or just like the disorder of sedentary lifestyle?
Well, there are different cases of arthritis. First of all, there is osteoarthritis and there is rheumatoid arthritis, and there are people who have a combination of the two. And osteoarthritis, it's usually the overuse of your joints. A lot of athletes have this problem. And just aging population has this problem because the joint tissue, the joint itself, the cartilage, gets worn off in an osteoarthritis. Rheumatoid arthritis is different because it's an autoimmune disease. And the approach would be different as well to the two processes. And even to two people with rheumatoid arthritis, for example, the approach will be different depending on the cause, what exactly causes rheumatoid arthritis in this person, what exactly causes the antibodies to attack its own tissue. So there is no exact protocols for everybody. They will be modified depending on your needs, depending on what you're presenting with, if you have toxicities, if you have gluten sensitivity, if you have certain nutrient deficiencies, the approach would be different. But certain dietary approaches would be pretty much universal, such as if this is an autoimmune process, patients will be off gluten, off dairy, and off red meat.
Similar to celiac disease, but it's even more radical. What type of diets, even genetic testing that's popular, do you recommend offhand? Do you recommend allergies or even the paleo or Atkins diet?
I really don't do allergy testing for foods because I don't believe there is a perfect test for it. So far, there are tests for IgE, so to speak, frank allergies, but for rather food sensitivities, there is no better test than the elimination diet. So when a person does an elimination diet, it shows, and then reintroduces foods in a stepwise manner, it shows what exactly is causing problem. So that's the best test. And as far as genetic testing, I always suggest people to do 23andMe because that's the most economic way to do it. And then their data is being interpreted by 2 different companies that look at methylation and detoxification, those 2 processes where we can interfere with nutrition and where we can help. So 23andMe is a pretty good test.
Did you see any like drawbacks of how conventional medicine, you know, like with Atkins and all these popular diets, have you seen any like problems or like patients just complaining or so many side effects they have with Jenny Craig or even those, you know, like curves or anything, those gyms where like they encourage women to exercise all the time?
Well, definitely when you go for something extreme, you're going to have side effects. So Atkins is a pretty extreme diet. There are variations in paleo diet.
Yes.
And I don't recommend either, actually, to people. My recommendation is high vegetable intake, 10 to 12 servings a day, and moderate intake of animal protein, because if your animal protein intake is high, you're facing damaging your kidneys and raising bad cholesterol and so on, etc. So that's not something I recommend. And I don't recommend people extreme exercise either. Over-exercising is as dangerous as under-exercising, and a lot of people don't want to see it or hear about it, but that is actually true. Some people are trying desperately to lose weight, exercising for 4 to 5 hours a day, and that itself might be a problem.
So many young teens have either body morphism where they don't see their body, or they have anorexia, and then they start depleting their hormones and androgynous hormones where they just develop in a different pattern. And so that is a different lifestyle Americans see now based on commercial advertising. Right. Yes. But basically, what are your top 5 of successful patients in functional medicine? The young women, the middle age, and also the elderly. Please talk about the successful patients you've seen.
So the most represented age group is actually 40s to 60s. There are some young people, as I said, like 19, 22, 25, 28-year-olds. The younger population usually presents with anxiety, depression, acne, and like the latest success story is a young patient who was treated for acne for a number of years, was on different courses of antibiotics, on Accutane, had a lot of side effects in terms of the gut function following the 2 rounds of Accutane, on hormonal treatment at the point when I saw her, but nobody actually checked her hormones. She was just put on certain agents without being checked for anything. So I did a pretty extensive workup of everything, including hormones and micronutrients, and I was able to have her acne under control with just herbals and supplements.
Nice.
Yes, and 58-year-old lady with bad diverticulitis, multiple hospitalizations, multiple rounds of antibiotics, and actually very good success with certain probiotic treatment.
Oh, good.
I was able to arrest her latest flare-up, and she's very happy.
Oh, that's very successful. And I was wondering, do you handle any women with MS or anything like chronic?
Yes, I do. Yeah, MS patients are the most difficult ones. Their diet is the most radical, and it's an autoimmune disease, as we all know, and requires very, very strict diet and lifestyle modifications. So probably you heard about WALS protocol. So
Yes.
that's basically what I advise people to follow and monitor them.
And do you, I've read a lot of material based on my own family, like Hashimoto, can women get pregnant, or is it lead also to infertility problems?
Well, it really depends where on the realm of Hashimoto patients are, beginning or end stage. Some people were treated for years and years for hypothyroidism, but they never had their antibodies checked. And then they come in and I test them and I see that antibodies are really through the roof. And it is difficult to conceive for those people, but they are usually in their late 40s or early 50s, so it's usually not an issue for them. It's rather an issue for younger women. And if Hashimoto gets under control, it's possible to conceive. So fertility is not going to be affected down the line.
I have two nieces that had Hashimoto, and they have different types of factors. And so even for my own family history, it can be painful when women can be pregnant at 22 or not. And so I was just wondering about that. And when did you open up your practice in Glenview?
I opened my practice in Glenview in January of 2017. Prior to that, I was working with another holistic group.
And why did you choose Glenview, of all the places in the United States and even Illinois, to locate yourself?
Well, I live in the vicinity. I live in Northbrook, and Glenview is just actually 1 to 2 miles away from my home, and it's a very nice, lively town. So I picked it up because I just like the surroundings. I like the place.
How do you like the traffic in the Glen? I'm sure you see lots of people come in and out. It's so fast.
That's fine in comparison to big cities. It's nothing, so no complaints. It's a very nice lifestyle here.
And I'm just wondering, how many patients do you see a year or are coming through the doors?
Well, the numbers in our line of medicine are not as big as they are in conventional medicine.
Yes.
Because we spend a lot of time face-to-face with our patients. For example, the initial consultation just takes 90 to 120 minutes and requires a lot of preparation on my part when I, at home or in my office, look at all the data that patients send to me, and I'm thinking about them, and I have a little bit of an impression about them even before I see them. So here we go, it's already a few hours. And then it also takes me time post-visit to process all of it and come up with the recommendations for the future, immediate future and more far away future. So numbers is not what we are after. It's the quality of care that is delivered, and it requires a lot of energy on my part as well. So I do not see 6 to 10 people during an hour like normal, usual, conventional practice does. Yes. But people are coming all over, also from abroad, from Ecuador, from Mexico. So it's a very rewarding way of practicing medicine.
And did you see any young mothers become pregnant or become fertile? Have you had any stories?
Yes, I had a story like that. Yes, so somebody with Hashimoto. But we don't follow people when they become pregnant. They're being sent to an OBGYN. And then after the delivery,
they send you thank you cards, I'm
yes,
sure.
they do.
And have you traveled anywhere outside the United States?
Yes, I have, mostly to Europe and Caribbean.
Oh.
My last trip was actually to Europe, It was the cruise of the Danube River, and it was fabulous.
And did you ever travel for any functional medicine symposiums or conferences?
Oh, yes, a lot. So we have our anti-aging annual congress in Las Vegas every December. Institute for Functional Medicine has its venues all over the country, as well as A4M. So, and I'm trying to attend as much as possible because interaction with people and seeing exhibitions and hearing speakers live, it's much more impressive and useful than watching it in recording. So when I can, I do attend.
And how many languages do you speak or you're comfortable with?
Comfortable with? It's a good question. Comfortable with probably 2, but I can say that I speak 4 to 5.
That is very interesting. And do you have any endeavors to open up, even expand your office or go a different studio or a different location?
I'm actually happy in my current location. I love the building, I love the environment. I would like to expand to do certain procedures for my patients in the future. At this point, it's just purely consultative practice, but in the future, I would like to do certain things. I have certain things in mind. It's a constant process of learning and expanding your knowledge and an attempt to bring all this to patients.
Thank you, Dr. Irina Tutunikov.
Thank you. Thank you for having me.
Thank you again for watching Real People, Real Matters with Diana Tulchinsky. Please come again.